Good evening. This is my final project for patient-oriented outcomes using clinical outcomes assessment in practice. Part one was depicting a clinical scenario. My scenario dealt with a 16-year-old female who was a high school junior who was a competitive swimmer, and I have her in a fitness class of mine, and during a dodgeball game she ran into the center to get a ball and collided with an opponent who was attempting to get the same ball. The athlete was hit by the opponent's shoulder on the right side of her jaw head, and at the time complained of tenderness but showed no other concussion symptoms and did not want to report to the nurse. I found out later in the day that 2 periods after fitness class, she did end up reporting to the nurse's office with a headache and dizziness. At that time, her parents were called and she was referred to her PCP. Putting this into the disablement model classification, the health condition, sports-related concussion, in relation to body functions and structures, she began to have decreased concentration during school and other activities, and complained mainly of headaches and dizziness. She was not able to swim or participate in any fitness class, and she also had restrictions on her classwork and time on phone, other reading, and computer work. The physician was the facilitator to the patient's ability to participate in swimming, fitness, and academics. Personal factors, again, she's a high school junior, 16 years old, and she also has experience with concussions, this being her second one. In relation to health-related quality of life, I believe this is an important factor in any situation. We look at health-related quality of life as a concept which refers to the synthesis of several health domains, including physical, psychological, and social, and these can be affected by that patient's beliefs, their experiences, what are their expectations, and then their perceptions of the injury and daily life. We can look at it as their satisfaction with life and then their general feeling of their personal well-being. For her, again, she's a competitive swimmer. She has high rankings with swimming, and the injury occurred a month prior to her season starting. She's also a very good student who now is unable to complete all of her necessary work, which has been hard and frustrating for her. The instruments that I chose to compare and critique were the impact test and the HIT-6. So starting with the impact test, it is very familiar to most of us, and it is widely used within athletic training clinics, sports medicine clinics, physicians' offices, as a computerized concussion evaluation. It can be taken as for a baseline and then throughout the recovery process, which makes that beneficial because you do have scores to compare each test to. It measures a patient's verbal, visual memory, processing speeds, reaction time, and symptoms. Again, it's very helpful if a baseline is provided for that person. However, you do need to have access to the program and a computer, and it does take some time to complete. Scores are pretty simple to interpret, and again, it's nice if that baseline is available to compare the post-concussive test scores. The second test I chose was the headache impact test, or the HIT-6. There is a link there on the PowerPoint that I provided if you've never seen this test. This was the first time that I had really looked at it. It has been developed from previous validated headache disability instruments, and it comprises of 6 questions that the patient can complete just using paper and pencil. It shows the effects of headaches on pain, social function, role function, vitality, cognitive function, and psychological distress. And these came from a scale that was narrowed from 89 items through a process of reliability, validity, and item response theory. The higher the score, the more impact headaches have on the patient's daily life. Again, it's easily accessible, it's easy to understand. It is, I believe, both patient and clinician friendly just because of the ease of it. And the scores, it can be scored quickly. And again, if you have the higher score, the more impact those headaches are having on their daily life. The one thing is that it does require a recall information within a 4-week period. And so sometimes people don't always remember that information clearly. One study also has found with the HIT test that in a population of adolescent athletes, the test-retest reliability score was 0.72. The reliability of individual items ranged from 0.52 to 0.67, and its internal consistency was 0.89 to 0.90. When we're measuring change, one of the things that we should be looking at is the minimal clinically important difference, or the MCID. And for clinicians, this is the smallest effect size that would lead them to recommend a therapy to their patient. If the difference is smaller than the MCID, it's considered worthless even if there is a statistical significant difference. So you need to be aware of your MCIDs for your outcome measures. Other things that we look at, and with this is, if there has been a baseline score provided, being able to compare those to your post-injury follow-up test and then the final test that you would administer prior to allowing them to return to play. So it's good to have those score comparisons for these patients. As a per diem athletic trainer, with implementing patient-related outcome measures, it would have to be something that would be simple, easy, quick. Since a lot of times I might just be covering, a game or, possibly as a tournament, information that would be able to get back to their head athletic trainer with ease as well. Both patient and clinician centered. I think again, that it's easy on both sides, and especially since if I'm working different events, that I'm not going to necessarily see the same patients over and over again. So not being able to know them and have that relationship with athletes that we would see on a daily basis. I would probably choose specific ones more often because they are dealing with this. How I'm doing right now is, I'm dealing with acute injuries more often than something that is chronic, and I'm seeing them at the beginning when the injury has just occurred. Some barriers: time. Again, I'm usually just, I'm covering a game or an event, a day event. So, being able to do something that will be quick would be more beneficial. And not having a home, athletic training room to be able to keep all the different tests, that I could possibly give these athletes. One solution could be that, if I had a tablet and had the instruments loaded and available on them, and then being able to have the scores there, everything's interpreted, and then being able to, send that as an email to their head athletic trainer. Here are my references. And thank you very much for your time. Have a good night.